During a re-examination drive, an examiner observes that you hesitate excessively at a clear four-way stop with no other vehicles present. What concern is this most likely to indicate? A. Lack of road sign recognition. B. Poor vehicle control. C. Delayed decision-making ability. D. Aggressive driving tendencies. Answer: C. In senior driver testing, examiners closely assess decision-making speed, not just rule knowledge. Excessive hesitation at a clear intersection suggests slowed cognitive processing rather than caution. While stopping is required, the driver must also demonstrate the ability to assess the situation and proceed confidently. Consistent hesitation can indicate reduced judgment speed, which is a known age-related risk factor evaluated in 2026 retesting standards. Why does Ontario place extra emphasis on left-turn judgment during senior driver assessments? A. Left turns are illegal at most intersections. B. They require higher insurance coverage. C. They demand simultaneous speed, distance, and gap assessment. D. They involve steering wheel strength. Answer: C. Left turns are complex because the driver must judge oncoming vehicle speed, distance, and timing all at once. For seniors, these combined judgments may take longer due to slower processing speed. Ontario's updated testing prioritizes this maneuver because left-turn errors are a leading cause of serious collisions involving older drivers. If glare from oncoming headlights causes temporary vision loss, what action best demonstrates safe senior driving judgment? A. Slowing slightly and continuing straight. B. Closing one eye to focus. C. Looking toward the right lane edge and reducing speed. D. Turning on high beams to improve visibility. Answer: C. Temporary glare blindness is common with aging eyes. The safest response is to shift focus away from the glare, reduce speed, and maintain lane position by referencing the road edge. This shows the examiner that the driver understands visual limitations and applies proper compensatory strategies, a key 2026 evaluation criterion. Why are senior drivers advised to increase following distance beyond the minimum guideline? A. Vehicles stop more slowly now. B. Road signs are harder to read. C. Reaction and braking decision time may be longer. D. Insurance discounts require it. Answer: C. The issue is not physical braking alone, but decision reaction time. Seniors may take longer to recognize a hazard, decide to brake, and then act. Extra following distance compensates for this delay, and is specifically recommended in Ontario's senior driver safety guidance used in current testing. During a retest, you miss a pedestrian stepping off the curb at a crossover. What ability is primarily being evaluated here? A. Peripheral awareness. B. Knowledge of speed limits. C. Steering precision. D. Night vision. Answer: A. Pedestrian detection relies heavily on peripheral vision and scanning habits. Age-related narrowing of visual fields can reduce awareness of movement at the edges. Examiners assess whether drivers actively scan sidewalks and crosswalks, not just look straight ahead. A flashing green light in Ontario signals which specific right. A. You may turn right only. B. You must stop before turning. C. You have a protected left turn phase. D. Pedestrians must yield. Answer: C. A flashing green indicates a protected left turn, meaning oncoming traffic is stopped. Senior testing ensures drivers still recognize less common signals, as confusion here can cause hesitation or unsafe stopping during protected phases. Why is driving during peak traffic discouraged for seniors when possible? A. Higher fuel consumption. B. Increased noise levels. C. Higher mental workload and faster decision demand. D. More traffic enforcement. Answer: C. Heavy traffic requires rapid decisions, lane changes, and constant monitoring. Ontario's senior safety model recognizes that cognitive workload, not physical ability, is often the limiting factor. Reducing exposure to peak traffic lowers crash risk. What is the safest response if you momentarily forget your intended route while driving? A. Stop suddenly to reorient. B. Make a quick turn. C. Continue safely and pull over when possible. D. Speed up to clear traffic. Answer: C. Sudden stops or last-second turns are dangerous. Safe judgment involves maintaining control, continuing to a safe location, then stopping to reorient. Getting lost is not penalized, unsafe correction is. Which change most commonly affects senior drivers' ability to judge oncoming speed? A. Reduced hearing. B. Reduced neck flexibility. C. Reduced contrast sensitivity and depth perception. D. Reduced pedal strength. Answer: C. Depth perception and contrast sensitivity decline with age, making it harder to judge how fast another vehicle is approaching. This directly impacts left turns, merges, and gap selection, all of which are heavily weighted in 2026 testing. Why does Ontario require medical reporting for certain conditions regardless of driving experience? A. To reduce insurance costs. B. Experience overrides risk. C. Some conditions can impair driving unpredictably. D. To limit senior licenses. Answer: C. Medical conditions such as sudden fainting, vision loss, or cognitive decline can impair driving without warning. Experience cannot compensate for unpredictable impairment, which is why reporting is mandatory. When approaching an uncontrolled intersection, what behavior best demonstrates safe senior driving? A. Accelerating to clear quickly. B. Yielding only if another vehicle appears. C. Slowing, scanning all directions, and proceeding deliberately. D. Stopping completely. Answer: C. Uncontrolled intersections require active scanning, not full stops or hesitation. The examiner looks for smooth, deliberate decision-making rather than uncertainty or abrupt actions. Why are shoulder checks emphasized during lane changes for older drivers? A. Mirrors are less effective. B. Neck movement is required by law. C. Blind spots remain even with mirrors. D. It improves balance. Answer: C. Mirrors cannot fully eliminate blind spots. Seniors may rely too heavily on mirrors due to neck stiffness, but examiners want confirmation that drivers compensate safely with proper shoulder checks. What does consistent drifting within a lane most often indicate during retesting? A. Wind conditions. B. Tire alignment issues. C. Reduced divided attention. D. Poor road markings. Answer: C. Lane drift often reflects difficulty managing multiple tasks simultaneously, such as steering while scanning signs or mirrors. This divided attention ability is closely evaluated in senior driving exams. If a senior driver takes longer to respond to a yellow light, what is the safest decision? A. Speed up. B. Brake hard. C. Stop if safe to do so. D. Ignore the signal. Answer: C. Yellow lights are warnings, not commands to rush. Seniors are encouraged to anticipate signals earlier and stop safely rather than accelerate through uncertainty. Why is route familiarity important but not sufficient for safe driving? A. Familiar routes reduce attention. B. Roads never change. C. Construction, signage, and traffic patterns evolve. D. GPS replaces memory. Answer: C. Even familiar routes change over time. Safe drivers continuously reassess conditions instead of relying on memory, which examiners actively observe. What skill is primarily assessed when merging onto a highway? A. Steering strength. B. Gap selection and speed matching. C. Lane marking knowledge. D. Signal timing. Answer: B. Merging requires matching traffic speed while selecting a safe gap. Seniors may struggle with simultaneous speed judgment and acceleration, making this a critical evaluation area. Why are seniors advised to avoid driving when emotionally stressed? A. Stress increases fuel use. B. Stress narrows attention and slows reaction. C. Stress affects hearing. D. Stress voids insurance. Answer: B. Emotional stress reduces focus and reaction speed. Combined with age-related changes, this significantly increases collision risk. What does an examiner conclude if a driver repeatedly needs reminders during instructions? A. Poor hearing. B. Vehicle unfamiliarity. C. Reduced working memory. D. Lack of experience. Answer: C. Working memory allows drivers to retain instructions while performing tasks. Difficulty here may signal cognitive decline relevant to driving safety. Why is daytime driving often recommended for senior drivers? A. Less enforcement. B. Better road conditions. C. Improved visibility and contrast. D. Lower speed limits. Answer: C. Daylight improves contrast, depth perception, and hazard detection, compensating for age-related visual changes. What behavior best shows readiness to continue driving safely as a senior? A. Confidence alone. B. Ignoring limitations. C. Adjusting habits to match abilities. D. Driving as often as possible. Answer: C. Safe senior drivers recognize limitations and adapt, such as avoiding night driving or heavy traffic. This adaptability is a core principle of Ontario's 2026 evaluation approach. During a driving assessment, an examiner notices you brake earlier than necessary at multiple intersections. What is this behavior most likely interpreted as? A. Advanced hazard anticipation. B. Reduced confidence in speed judgment. C. Aggressive driving style. D. Mechanical braking issues. Answer: B. Early braking can be a safe habit when used appropriately, but repeated unnecessary braking may signal uncertainty in judging speed and distance. Examiners assess whether braking matches actual risk. Overcautious braking can disrupt traffic flow and indicate reduced confidence rather than improved safety awareness. Why is scanning left-right-left at intersections emphasized more for senior drivers? A. Traffic laws require repetition. B. Hearing declines with age. C. Visual processing speed may be slower. D. Steering response weakens. Answer: C. As visual processing slows, repeated scanning helps compensate by allowing more time to detect movement. Ontario's senior assessment emphasizes scanning patterns because missed hazards often result from delayed visual recognition rather than lack of rule knowledge. What does difficulty maintaining a steady speed most commonly suggest during retesting? A. Engine performance issues. B. Poor road surface. C. Reduced divided attention. D. Incorrect speedometer reading. Answer: C. Maintaining speed requires monitoring the road, traffic, and dashboard simultaneously. Fluctuating speed often reflects difficulty managing multiple inputs at once, a key cognitive function assessed in senior evaluations. If you misjudge the distance of an oncoming vehicle during a left turn but stop safely, how is this typically evaluated? A. Automatic failure. B. Minor observation if corrected safely. C. Major traffic violation. D. Ignored by examiner. Answer: B. Senior exams focus on error recognition and correction. A misjudgment followed by a safe stop shows awareness and self-correction, which is viewed more favorably than proceeding unsafely. Why is it unsafe to rely only on experience when driving familiar routes? A. Traffic volume is lower. B. Memory replaces observation. C. Road conditions and patterns change. D. Signs become unnecessary. Answer: C. Construction zones, new signals, and altered traffic flow can appear without warning. Safe driving requires active observation, not memory-based assumptions, a key distinction examiners watch for. What does hesitation while merging onto a freeway most often indicate in senior assessments? A. Engine hesitation. B. Inadequate signal use. C. Difficulty matching traffic speed. D. Fear of highways. Answer: C. Merging requires rapid speed adjustment and gap selection. Seniors may hesitate due to slower processing of fast-moving traffic, which examiners closely evaluate for safety risk. Why is mirror signal shoulder check sequence emphasized rather than any order? A. Habit formation. B. Legal requirement. C. Ensures blind spot verification after intention. D. Saves time. Answer, C. The sequence confirms that after signaling intent, the driver verifies blind spots before moving. This reduces the risk of lane change collisions, especially with cyclists or fast-approaching vehicles. What does a senior driver demonstrate by smoothly canceling a turn when conditions change? A. Confusion. B. Lack of confidence. C. Adaptive decision-making. D. Route unfamiliarity. Answer, C. Adaptability is a positive trait in senior assessments. Safely canceling a maneuver shows situational awareness and the ability to reassess risk in real time. Why are senior drivers advised to avoid multitasking, even hands-free? A. It is illegal. B. It increases fuel use. C. Cognitive load reduces reaction speed. D. It affects hearing. Answer, C. Hands-free does not eliminate mental distraction. Cognitive load competes with driving attention, which is already reduced by age-related processing changes. What does repeated difficulty following verbal directions during a test suggest? A. Examiner error. B. Hearing impairment only. C. Reduced working memory. D. Nervousness. Answer, C. Working memory allows drivers to retain instructions while performing tasks. Difficulty here may signal cognitive decline relevant to driving safety decisions. Why is controlled lane positioning important in narrow lanes or construction zones? A. Protects tires. B. Improves fuel efficiency. C. Demonstrates spatial awareness. D. Reduces speed. Answer, C. Maintaining lane position shows the driver understands vehicle width and spacing. This spatial judgment is closely evaluated in senior driving tests. What does failing to notice temporary road signs most commonly indicate? A. Sign placement issues. B. Visual acuity decline. C. Reduced scanning behavior. D. Poor memory. Answer, C. Temporary signs require active scanning. Missing them suggests attention is fixed ahead rather than broadly distributed. Why are senior drivers encouraged to plan routes in advance? A. Saves fuel. B. Avoids tolls. C. Reduces real-time decision stress. D. Improves memory. Answer, C. Advanced planning lowers cognitive demand during driving, reducing stress and error likelihood, an important safety adaptation. What is the safest response if traffic conditions become overwhelming? A. Continue regardless. B. Increase speed. C. Pull over safely when possible. D. Follow other vehicles closely. Answer, C. Safely stopping allows recovery and prevents decision overload, which is a known contributor to senior-related crashes. Why is daylight preferred for license retesting when possible? A. Examiner preference. B. Reduced enforcement. C. Optimal visual conditions. D. Lower traffic volume. Answer, C. Daylight reduces glare, improves contrast, and supports safer decision-making, especially for aging eyes. What does delayed response to changing traffic signals most often indicate? A. Inattention. B. Vision failure. C. Slower cognitive processing. D. Poor braking system. Answer, C. Signal response relies on quick recognition and decision-making. Delays reflect processing speed changes, not mechanical issues. Why does Ontario encourage self-assessment for senior drivers? A. To reduce testing costs. B. To limit licenses. C. To promote early risk awareness. D. To enforce penalties. Answer, C. Early self-recognition of limitations allows drivers to adapt habits before safety becomes compromised. What behavior most strongly indicates safe senior driving competence? A. Driving frequently. B. Driving confidently. C. Adjusting driving habits proactively. D. Avoiding all highways. Answer, C. Safe senior drivers adapt, choosing safer times, routes, and conditions, rather than relying on past ability. What is the greatest risk of overconfidence in senior drivers? A. Reduced caution. B. Slower reaction. C. Ignoring compensatory strategies. D. Increased stress. Answer, C. Overconfidence may prevent drivers from adjusting habits to match changing abilities, increasing risk. What final factor most influences examiner recommendations after a senior driving test? A. Age. B. Years of driving. C. Overall safety judgment. D. Vehicle condition. Answer, C. Ontario examiners assess overall safety judgment, including awareness, decision-making, and adaptability, not age alone.